Good evening, and welcome to tonight's live telephone town hall with Congresswoman Marcy Kaptur, your representative for the 9th District of Ohio. My name is Gordon, and I'll be moderating the conversation tonight. In a few moments, we'll be joined by the Congresswoman. But before we begin, I'd like to explain what will happen in the next hour. If at any point in tonight's call you would like to ask Congresswoman Kaptur a question, simply press *3 on your telephone keypad. Again, that's *3. You will continue to hear the town hall until one of the Congresswoman's staff members can assist you. If you don't have a chance to ask your questions during tonight's call, please note you'll be able to leave a voicemail for the Congresswoman and her staff at the end of the call simply by remaining on the line. Again, if you would like to ask Congresswoman Kaptur a question, please press *3 on your telephone keypad now. With that, please welcome Congresswoman Marcy Kaptur.
Thank you, Gordon, very much, and good evening, friends. This is Marcy. Thank you for joining us tonight. We have two special guests I'm going to turn to very quickly because all of us are as concerned as you are about the threats to Medicaid, Medicare, and Social Security, all earned benefits. And we know how important these are, how vital they are for so many thousands of people across our region. Please know I'll continue to push back on reckless actions by this administration and others in Congress that could impact and hurt you, your families, and our Northwest Ohio communities. Standing up for our seniors is one of my highest priorities in Congress, and that's why I support strengthening Medicare, Medicaid, and Social Security, not cutting and gutting them to pay for even larger tax cuts for billionaires. We'll get into that a little bit. We have a good understanding of the difficult situation families are in, struggling to make ends meet. And we know that the formula that the Trump administration is working on would be very damaging across our nation. So know that people like myself care deeply and are working very, very hard to try to ameliorate this situation. I also wanted to say before we introduce our guests that the Senior Farmers Market Nutrition Program that is eligible for individuals 60 years or older, it will start again in our region, and they are now accepting applications for this year for seniors who are 60 years or older. If you earn under $29,000 as a single individual or under $40,000 as two individuals, you can be eligible. And if you are over 60 again and you meet those income requirements, you can apply online through the Ohio Department of Aging, or you can call right here in our area, the Northwest Ohio Area Office on Aging at 419-382-0624, and they do provide $50 to purchase fruits, vegetables, honey, and herbs during the summer months from our local growers. So it's a win-win for you and a win-win for our farmers. Because of time constraints, the two guests that are with us today, first, Congressman John Larson of Connecticut, who is the foremost expert in the Congress and leader on a policy to protect, defend, expand, and extend Social Security for current beneficiaries and generations to come. I'm going to have him tell you with what has just happened that will require him to go back to the Capitol. And then our second guest will remain with us, Mr. Max Richtman, who is President and Chief Executive Officer of the National Committee to Preserve Social Security. I want to thank all of you for participating today, and we'll have a good discussion. Congressman Larson, thank you so much. I know you're traveling the entire country dealing with what is happening now, and I want our listening audience to know they couldn't have a more important person to talk to in the entire Congress, because you are right in the boiler room when it comes to Social Security, Medicare, Medicaid. Thank you so much for being with us tonight.
Just a quick reminder before Mr. Larson introduces himself, you can press *3 at any time to ask a question. That's *3.
An honor to be with you, Marcy, and let me say that the constituents that you represent in Northwest Ohio are blessed and fortunate. I'm also honored as well to be here with Max, and you'll hear more from him as we go forward. And I apologize, Marcy, that I have to, as you know, go on to another meeting at the Capitol. And why? Because what we're facing here is an administration and Republicans who are dug in on cutting and doing damage to America's #1 anti-poverty program for the elderly and America's #1 anti-poverty program for children. That's Social Security. You're blessed to have a representative who cares as deeply about the elderly and children as she does her own family. She has been an original co-sponsor. Let me explain what that means. What that means is that she wrote and constructed the bill from the very beginning. Here's what was important to Marcy. First and foremost, that there be an across-the-board increase in Social Security. You know, the last time that Social Security was enhanced, Richard Nixon was President of the United States. I've been working with Marcy for more than a decade to not only protect, but enhance and expand Social Security. That's her commitment. But it goes beyond that. It was also about the repeal of WEP and GPO that wrongly penalized firefighters, police officers, teachers, municipal employees as well, who had worked and paid into the Social Security system but were wrongly penalized back in 1983. He's got the provision that not only repeals that, but pays for it so that the Social Security system remains sound. And there's no other system that can boast never having missed a payment. It is the largest insurance program in the country. More than 70 million of our fellow Americans rely on it, and it's never missed a payment. And yet the Trump administration, through Elon Musk, is out to privatize it, and to do so by first weakening Social Security, laying off, cutting field offices, cutting services, laying off people. Make no mistake about it, a cut to individuals is a cut to your Social Security. Imagine this. It's the largest insurance company in the country, because that's what Social Security is. It's an insurance plan. And yet it's administered for under 1%. I come from Hartford, Connecticut, an insurance capital of the world. And on average, their administrative costs, 16 to 26%. And they don't have nearly, a lot of individual companies, all good companies, but they don't do nearly what Social Security does. And as everyone on this line understands, Social Security has never missed a payment. Back in 2008, we don't have to go back to 1929. You go back to 2008, 2009, when people saw their 401k become a 101k. And yet during that time period, Social Security never missed a payment. That's what Marcy is fighting for. But she's also fighting for to make sure that we expand it so that, for example, people who continue to work, and many have to, after they retire, that their Social Security benefits don't get taxed. That's nothing short of double taxation. And again, thanks to Marcy Kaptur, part of the bill makes sure that that no longer can happen. And what that means is that individuals will see an increase. More than 23 million Americans will get an increase in their Social Security because it will no longer be, as Marcy says, double taxed, which is wrong. But unlike Trump and some of the other, we pay for this so that the trust fund remains intact, so that it remains there, so that it guarantees the payments for all individuals. Marcy also made sure that there's no wait period or wait time for people that are on disability, because we've heard from so many. Imagine that there are people who have died waiting to get a disability check from the federal government. That's wrong. That's outlandish. In the wealthiest nation in the world, with the most successful insurance program, we have got to make sure that these programs are funded, that they are staffed, that people can get the answers that they need. And that's why we're fighting what Trump and Elon Musk are doing in terms of closing offices, cutting down phone services. Why are they doing this? To weaken the program so they can turn to the people and say, oh, that's Social Security, that's not working, that's not efficient, that's not effective, when in fact, as all of you know, and not just in the case of pensions, you know that Social Security also protects spouses, it protects widows, children, and also provides more disability to veterans than the VA does. I know Max Richtman will go over this, et cetera, and states it in more eloquently than I do. But again, when you have someone like Marcy Kaptur who's in there fighting for you on your behalf, then you know that you're being well served as well. And, you know, aside from being for all of those provisions as well that are equally important, standing up and make sure that it's an across-the-board increase, making sure that no one can retire into poverty. When Marcy came to me and said, John, it breaks my heart to know that there are more than 5 million of our fellow Americans that get below poverty level checks from Social Security, having paid into it all their lives. And the reason for that, because Congress hasn't taken action. And now Marcy Kaptur has stepped up and said, we need to change that. And you know what? Of those 5 million Americans, a majority of them are women, because women were the care providers. And when women were in the workforce, they weren't making what their male counterparts were. So Marcy has changed the new floor for Social Security. It'll be 125% of what the poverty level is, so that no one can work all their lives and pay into Social Security and get a below poverty level check for that. Marcy, thank you so much for that, and all that you do, not only for your constituents, but as a leader in Congress, as someone who everyone looks up to and respects. When you go to the floor and speak, the people listen. Thank you for all your work. Thank you for all your efforts in making this Social Security bill the most comprehensive ever. We're going to get this done, not only on behalf of Northwest Ohio, but for all of the country. God bless you, Marcy.
God bless you, John Larson. Thank you so much. I want you to take 30 seconds more and just tell the dear people from my region, where are you going now? You're going back to the Capitol. You're going to your Social Security Committee, correct?
Correct. The Ways and Means Committee has got a special caucus this evening because of the, as you know, the Republican proposals in their budget to cut Medicare, Medicaid, Social Security. We haven't seen the language yet. But we're going to be getting it piece by piece, but we want to make sure that we're prepared to fight them every inch of the way. We will not let this happen.
Boy, I just want people to know how hard this is to do, John, and how many years have you been working on this with supportive members of Congress like myself. Let the people know how long it takes.
Oh, yeah, no, it's been more than a decade, but you and I introduced the bill back in 2012, and I couldn't have a better ally and a better supporter. And as you heard me say, someone who just doesn't support the bill, but contributes to the important things about it, to make sure that we're not just protecting Social Security for you, we're expanding it because it hasn't been done since 1971. Have a few things changed since then? I think so, and Marcy thinks so, and that's why we're out to change this and come up with an increase so that people in this inflationary time, in the aftermath of a COVID pandemic, have the wherewithal and the monies they need to make ends meet. Nobody gets wealthy on Social Security, but for God's sake, it does what it was intended to do, to make sure that people who pay into a process and put it into this trust, that the money is there for them so they can live in dignity in their final days.
Well, John, we just appreciate your talking with our constituents on such an important evening for you. And I want you to know, while you go into that battle in your committee, which is critical, the bill has to come out of your committee whole so we can vote on it. Out here in Ohio, some dark money groups are funding very misleading advertisements on television out here that is saying that I want to gut Medicaid and Social Security and Medicare, and it's 100% false. And I'm just so offended by it. So I just thank you for being part of the real fight, and I hope people aren't fooled.
It's good that you've got Max there, because he's going to go through this, and he talks more eloquently. It's fortunate you have the head of the National Committee to Preserve and Protect Social Security and Medicare, and who pushes back against, and he'll say it outright, lies that they come out with. And imagine people believing that of you, someone who's dedicated her whole life to helping people and preserving, protecting, and now expanding Social Security and Medicare. Is flat out wrong, but you brought the right person in terms of Max to make sure he explains and gets that through.
Thank you, John, and good luck tonight. We so admire you and so admire your work over a long period of time. You never gave up. Thank you.
Thank you, Marcy. All the best.
All right. I'm going to ask Max, the preeminent expert nationally as President and Chief Executive Officer of the National Committee to Preserve Social Security and Medicare, to just hold for a second, because I'm going to ask our staff, Gordon, if you could just bring up the first question, and then Max can make a presentation and answer the question, or I can. Could you do that, Gordon, just to begin to, because we have hundreds of people on the line.
Absolutely. And just a quick reminder for everyone who's listening, you can press *3 at any time if you want to ask a question. Again, you can press *3 on your phone if you would like to ask a question. Up first, we have Kelly Holmes. Kelly, you are live on the call.
Hello.
Hi, Kelly.
Hi. Yeah, I have been really stressed out. I have 2 adult children with special needs. They're unable to work due to intellectual cognitive issues, and they both depend on their SSI, Social Security, and Medicaid. And I've been very, very concerned over these past few weeks to these possible cuts to their benefits. And I was wondering if you could help relieve some of that stress for me.
Well, first of all, you can always call our office, okay, 419-259-7500. You can always do that. But I just want to say to all the people who are listening tonight, don't let them get to your souls. You are doing the very best you can for your families, and we understand that SSI, that Medicaid are critical to your family. And we are fighting for you. That's what this is all about. That's what's going on in the country right now. We have a group of people who serve in the Congress who want to give more tax cuts to the wealthiest people in our country, and they're trying to look across the government into accounts that have funding, and they want to take some of that money and give it to the super rich. You know what? The super rich don't need it right now. They have plenty. They are doing very, very well. The top 1% of people, of earners in our country, the top 1% own as much as the bottom 50% of our country. That's how wealthy they've become. So I think they're doing just fine. And what we are fighting for is human life and dignity for people who are caring for their loved ones. And we don't need to cut these programs. The Trump administration has been throwing different numbers around, anywhere from 500 to, $800 billion over a period of time, taking it out of these programs and putting it to either balance the budget. I'm all for balancing a budget, but not by causing people to lose their health insurance and their coverage. But they don't want to tax people who are making billions. And so it's really so unfair to the American people. I'll let Max comment as well, but don't let them get to your soul. We're going to win this fight. They haven't been able to reach agreement among themselves on the other side of the aisle because some of their people do have a conscience, and they know that that isn't the way to go. And so they're fighting among themselves. We have no idea exactly what they're going to propose. That's why Congressman Larson just ran back to the Capitol. I'm still in Ohio right now. I'll fly back tomorrow. But we are fighting for you. Know that there are people fighting for you. I don't think they're going to win this fight, but we can't let down our guard. Max, do you want to comment to this fine woman?
Well, thank you so much. First of all, Congresswoman, thank you for inviting me to this teletown hall meeting. I was really struck when Congressman Larson noted that your constituents are blessed, he said, to have you representing them. I know that's a fact because I have been to your district a number of times with you, done teletown hall meetings like this one, and they are indeed blessed. As to the caller's question, he's worried about 2 adult children who have special needs or an SSI. That is at risk. SSI is funded through general revenues, as you know, not through the Social Security Trust Fund, not through the Social Security program, through the trust fund. So she is right to be concerned because right now the House is expected to vote on legislation in the coming days that could cut the Medicaid program by $717 billion. That puts those benefits at risk. That puts SSI funding at risk. And I think she is lucky to have you and Congressman Larson and many other members of Congress that are committed to protecting these programs. These are going to be, as you know, you're a good vote counter. You've been there for a while. These are going to be some very close votes, and there are some Republicans that are going to have the same kind of concerns that the caller has, and we'll be watching that vote very carefully and counting on you and our champions for Social Security, Medicare, and Medicaid to defeat proposals that would hurt people such as the one who just called.
And I just want to thank you, Max. I just want to say also that if the Republicans are successful, I don't think they will be. We're fighting as hard as we know how. And in the House, there's a very narrow margin. And there are Republicans of conscience. They know that if these cuts were to go through, their rural hospitals would be closed down. The region I represent, frankly, some of our hospitals will go down, and both in urban and rural areas. So she's not alone. She should know, and the people who are listening should know that there are many other elements of our health system that will be impacted, and all of them are trying to contact members of Congress on both sides of the aisle, and we see some progress. But still there are those that want to cut $500 million out of parts of our health programs, billions in other places, and that is what Congressman Larson just went back to try to help deal with in a very late evening meeting on the key committee in all of this. So I think we should take question 2.
Perfect. And just a quick reminder, you can press *3 at any time to ask a question. Up next, we have Linda Dean. Linda, you are live on the call.
Hi, Marcy. First of all, I just want to say how great you've been for the people of Ohio. And the minute that commercial came on TV, it's like people don't believe in that, you know. And you actually helped get my mom and my aunt's brother back from the Korean War that he was in and died over there. So you actually helped get him over here into Port Clinton, which was his home. And it couldn't have made them happier. So I just really wanted to say thank you for all that you do.
Thank you so very, very much. And we were privileged to be involved to try to help your family and to properly return him to his homeland. All right, we'll go to the next question.
Up next, we have Nancy Ellis. Nancy, you are live on the call.
Hi, Nancy.
Hello, Marcy. First of all, I want to thank you and Sherrod Brown for all the work you did for the Social Security Fairness Act. And I'm a person that was a state worker, so I am eligible for it. And I know I've talked to them, and they say you've got to be patient. You got to be patient. The worry right now is, of course, with what they're doing, you know, that I won't get it, and truthfully, I can use the money, and they're saying it could take till November to get it. When you're 74 years old, you don't feel like you have time to sit and wait for money.
Well, I'll tell you what, you know, the Trump administration has been forcibly moving people out of their positions. Mm-hmm. And so what's happened is some of the Social Security offices are understaffed, and also at one point they said you can't call Social Security anymore, and we forced them to turn that around and still allow Social Security offices to answer the telephones. So if you visit a Social Security office, take them, a donut, or take them some. They are working so hard, understaffed, and as of earlier this month, they had already processed 84% of the Social Security Fairness Act adjustments. Okay, so they are moving. And for those of you still waiting, please know that they are releasing retroactive benefits and sending new monthly benefits amounts as they process each case. You can also call our office, and we will put in an inquiry for you. And our phone number is 419-259-7500. They have been really making progress on that, and believe me, we get calls from many, many grateful constituents.
Up next,
Thank you,
we have
Nancy.
Mike. We have Mike in Sylvania Township. Mike, you are live on the call.
Oh, well, thank you. I appreciate the opportunity. Marcy, I also heard that commercial. I knew immediately that it was all falsehood because that's not who you are. I've written you a couple letters, and I've written the Blade a couple letters about the cap, the ceiling on payroll withholding. Over half of the payroll paid out in America, or almost half of the payroll, is paid to people who make over $178,000 a year, and they're not paying payroll withholding on that full amount. So we're only getting payroll withholding drawn on about half of pay in America. We could obviously do a better job of supporting the payroll, the Social Security Trust Fund, if we raise that amount. Is there anything that could be done to raise the withholding ceiling and better fund payroll? Also, I'd like to comment that I had reason to go to my Social Security office 2 weeks ago with a problem I had. I was treated great. I only waited about 45 minutes. I was in person, and I thought that was pretty good service, and I don't want to see the people who helped me get cut.
Thank you very much. They are working so hard. They are a public service. You have paid for them through your earned benefits. And we make sure that those offices are funded. And I think that the way the federal employees have been treated has been very rude and very unfair. And so if you go into a post office, if you go into any federal building, I don't care where it is, thank them. Those folks taking care of our veterans, they are providing a service. Not everybody's involved in a profitable enterprise. Some people need services for different things, whether it's fire service, whether it's medical service. These are services. This is not like running a real estate operation, but people have human needs that we try to take care of. And the way they've been treated, I mean, they were letting people go from the National Park Service, and we're going into tourist season, you know. You can't do that. You've got to make sure the pathways are clear. You've got to handle the parking. I mean, there's things people do where they're not earning, you know, the top salary in America, but they're providing a really important national service. So thank you for what you've said. The answer on your suggestion is yes. One of the issues they're looking at in the Social Security is at what level we would impose the FICA tax. And Congressman Larson just went into his meeting on that. And other issues. I'll let Max comment on that. There are those that say also if you are receiving Medicare and you earn above a certain level, maybe you should pay a little bit more. These are items that the Ways and Means Committee works out, and then they bring a bill to the floor. Max, are you comfortable commenting on that?
Yes, absolutely. First of all, let me just go previous question about the Social Security Fairness Act that you spearheaded and it was signed into law in January. That was a great accomplishment. It will help millions of people get the fairness they, as the title of the bill states, of their Social Security benefit. As to the payroll tax, we have been working on adjusting that cap for decades. It changes a little bit every year. It goes up a couple of $1,000s. But it is way lower than it ought to be to bring in the revenue that's needed to extend the life of the Social Security program and to improve benefits. The bill that you and Congressman Larson support, it had a couple of hundred co-sponsors in the last Congress. It addresses that head on. It changes the cap, adjust that, so that the wealthy do start paying their fair share. You know, Congresswoman, 25 years ago, about 92% of wages were covered by the payroll tax. Now it's closer to 80%. Why? So many of the wealthy have made so much more money, are being paid so much, that it is diminishing the amount of revenue the program needs to fully fund, not just for the next 10 or 11 years, but way beyond that, to fund all beneficiaries and to improve the program. So I'm hoping that there'll be enough members of Congress in this coming session that you just began a few months ago to get that over the threshold.
I hope so. I hope all of this turmoil results in something really great. Thank you so very much for calling, Mike. Let's go to the next question.
And just a quick reminder, you can press *3 at any time to ask a question. Up next, we have Patsy Cook in Port Clinton. Patsy, you are live on the call. Patsy,
hello,
are you
Patsy?
there?
Yes. Hello.
Hi, Patsy, you're live on the call.
Oh, okay. Yeah. I have two issues because I am a senior. I paid into it the 40 years I had to, the 40 credits. To me, if they take any of it, it's theft of funds, it's breach of contract, and no, I'm not an attorney, but that's just my thoughts. And I also have a disabled daughter that is just turned 51. She just got her Social Security. They approved it December of 2023 after 19 years. She's got MS. She's got low CSF. She's got diabetes. So of course she's on SSI and she's on Medicaid. Do they not understand it's not just the hospitals that will go under? It will be our kids. It will be our parents. It will be our. Do they not understand that they will create death and it's done on purpose, and that's got to be crimes against humanity? I mean, we got to hit them wherever the truth is.
Thank you so much for bringing that up. You are correct. It's human lives that are at stake. And the important role Social Security plays, it's not only a retirement program, it's an insurance program in the event that a working spouse dies and the children are under age 18, and it is also a disability program, just what you've said. It's a phenomenal insurance program. And I wish these people understood it. They must never have faced what you face in your family, and what a credit you are to your daughter. And what a loving caregiver you are. There are people, thousands of people across our country facing these human challenges, and you are meeting it. I'm just glad you called in and shared your story. Max, do you want to comment?
Well, I think it's important that we understand what FICA stands for. FICA, Federal Insurance Contribution Act. It funds old age survivor and disability programs. So as Congressman Larson talks about, whenever I have a conversation with him, this is insurance for families. And I like to use as an example, a lot of younger people aren't aware that Social Security is there for them right now, not just for when they retire. But if, as an example, if you are a 27-year-old worker with a spouse and 2 children, you have almost $2 million in value of life and disability insurance through Social Security. A lot of younger people don't realize that and probably don't understand that it's there until something bad happens in the family, and someone might say, you should check Social Security. You could be protected. And so it's very, very important, especially, as you know, Congresswoman, younger people are the most cynical about the future of Social Security. They've been bombarded with misinformation for decades, and they need to be reassured that with the proper changes in Congress, I'm talking about the bill that you and Congressman Larson have sponsored, it will be there way beyond the next 10 or 11 years, but it's also there right now as insurance for families. It's a very important concept about Social Security.
Thank you, Max. And we know that 1 in 5 workers will become disabled in our country. We here in this region of the country, because of having a lot of agriculture as well as industry, we have people who have accidents and they get things happening to them. We even have an orthopedic hospital in Toledo because we have so many and orthopedic specialists because of the many disabilities people are burdened with as a result of their hard work. So Social Security is there for them. And we thank you very much for calling in, and we'll go to the next caller.
Up next, I'm going to read out one of our online questions from an online listener. Pat Linehan asks, will seniors still be getting certificates this year for farmers markets?
I'm sorry, I didn't hear that.
The next question is from one of our online listeners, Pat Linehan. He's asking, will seniors still be getting certificates this year for farmers markets?
Yes. What we are letting people know is that the Senior Farmers Market, they've called it Nutrition Program now, is accepting applications for this year. And they will receive a $50 coupon that they can use to purchase locally grown fruits, vegetables, honey, and herbs. If you're 60 years or older and you earn $29,000 or less as a single individual, or $40,000 or less as a couple, you are eligible. And the best way to apply is by calling the Northwest Ohio Area Office on Aging at 419-382-0624. Now, I hope the President of the United States doesn't pull the rug out from under this program. I'm on the Agriculture Committee. We just had a hearing last week, and unfortunately, the majority party does not have an agriculture bill ready yet. But we did pass a bill earlier, and this funding was in there. The President has not been able to pass a farm bill, an agriculture bill in the Congress, but we did provide funding that Congress voted for this program for the year of 2025. He has no right to take that money back. That was passed as an act of Congress. So we are hopeful, and I spoke with the new Secretary of Agriculture about this during testimony last week, that we want this program and we're asking them to expedite the implementation of the program. So the best way we can help is by having people register. As I've mentioned, you call the Northwest Ohio Area Office on Aging at 419-382-0624, and they receive a voucher, a benefit coupon to purchase $50 during the summer months. And believe me, the seniors really appreciate that program, and so do over 150 local farmers.
Up next, we have Gary Polyvanel in Erie County. Gary, you are live on the call.
Hello, Marcy.
Hi,
thank you very, very much for everything you've always done and for getting yourself out here on this phone call and other things. That's really important to me. It's one thing to sit there and vote, but it's another to make yourself known to other people. Question is, a little background, I was a computer programmer for 10 years. I ran an IT department for 10 years. It takes years to roll out new software. Meanwhile, Social Security could be decimated, and Trump and Musk will then have a reason to stop it. This is regarding the punishment for doing something so heinous. What they're doing may or may not be legal, but he claims it is legal. He's ignoring judgments, and he's operating illegally. I know I was a computer person for a very long time. You can't do that without complete destruction. So, what can be done and what can be done currently in Congress to build stop that?
Well, first of all, Gary, thank you very much for calling in and for sharing your expertise. Obviously, we are deeply concerned about what Elon Musk might have in the way of computerized information. I'm saying this to any attorneys that may be listening. Every American citizen has a right to challenge what they are doing in the courts. And there are many attorneys that will work pro bono on this. Some of them are retired. They're out there. Perhaps they haven't thought about challenging as individuals in the courts their right to sunshine on what the Musk Doge group is doing across the government. They have gone into Social Security accounts. I can't tell you how deeply. I don't know. But I do know that they're not allowed to do that. But there have to be cases in court. Maybe some are filed around the country and I'm just not aware of it. Maybe they've been filed in our district in a federal court. I just don't know, sir. But I think it's important to take your concern to local attorneys that on a pro bono basis would put cases in the court. I've noticed that as judgments have come down in different programs, an individual who wins a case, even at the appellate level or higher, the administration will change behavior. And just the filing of the case sometimes causes that to happen. My worst worry is that the Doge bunch with Mr. Musk have obtained information that they will then use to try to privatize certain aspects of the federal government, which I think is truly dangerous, and that they could potentially be charged with theft of very personal private information, because we don't know. I don't know, as a member of Congress, what they've taken. I just know some of the agencies they've been in, and we don't have definitive information. We need to have, and I say this, yes, I'm a member of one political party, but the best thing America could do next year would be to make sure that we elect a Democratic House, because we have a Republican Senate. Okay, let them hold on to the Senate, but we really need the other shoe to fall so that we have some set of gavels where we can have hearings, where we can bring in witnesses. Right now, our hands are tied. We're relying on the judicial branch, the third branch of government, to try to get some equity, to get some balance here between the powers that exist across our federal government. But I am deeply concerned, as you are, what kind of private information could they have taken from the Social Security Trust Fund, which has over $2 trillion in it, and seek to privatize the operation and pay themselves $1 billion a year, let's say, for trying to manage those dollars that don't belong to them. Those belong to the American people and to the Social Security Trust Fund. I'll have Max comment as well, but I am worried about the privatization of Social Security.
Well, Congresswoman, it's no wonder that you're worried. And people around the country, I've done 7 town hall meetings in the last six weeks with members of Congress. I've never had that many people show up, 800 people at one, 300, because people are concerned. And all of the things that you have talked about and some of the callers have mentioned, cutting the funding for staff, eliminating regional offices, cutting the funding to operate the program, lying about. You were there in the Congress about 3 months ago when the president implied that people 100, 200, 300 years old were getting Social Security. That's a lie. Or when Elon Musk says it's a Ponzi scheme, which is what the president has said in the past. This is a program that, as you know, will celebrate its 90th birthday, August 14th of this year. Everybody that's been expecting to receive and qualified for benefits has received their benefits all those years on time. That's not a Ponzi scheme. All of these things have one thing in common: undermine the support of the program, which has been there consistently with Democrats, Republicans, and independents, overwhelming support. Undermine that support so that the next step can be taken, and that, as you pointed out, would be to privatize the program, which puts it at risk, puts the insurance aspect of it at risk, puts the very nature of Social Security at risk.
And you know, this is a little off topic, but when I was working on the World War II Memorial Bill years ago, one of the big stumbling blocks we faced in the Congress was there was one congressman who wanted to privatize the World War II Memorial and put himself in charge. And he had a bill to take the money and put it in a private bank and then put himself in charge. I couldn't believe it. I said, this is equal to the Lincoln Memorial, the Washington Monument, and the World War II Memorial, each representing a century of this nation's existence, and the most important aspect of that century, the founding of the Republic, the preservation of the Union, and the victory of liberty over tyranny. And that any member would think to make money from that, I took as such an affront, such a defilement of what the country's about. And but people should know that there are people that think that way, including about the Social Security Trust Fund. So I'm not in that camp. I believe it belongs to the people who earned it. It's an earned benefit, and nobody should try to make profit off of that. Thank you, Max, very much, and we'll take the next call.
Thank you.
Up next we have Linda in Oregon. Linda, you are live on the call.
Hello, my name is Linda. I'm from Oregon, Ohio.
Hi, Linda.
Hello. Hi, Marcy. I want to thank you and all your constituents, because over the years I was a homemaker for over 20 some years and then was asked for a divorce and left with nothing because I had always worked at jobs that didn't take Social Security, farm work, and things like that. Long story short is I got my first full-time job, fortunately. I worked at a county health department for a little bit over 10 years, and then I worked for a mental health agency in the county also for 10 years of records with the psychiatrists, patients, etc. Anyway, when I retired, I was stunned to know that they were taking part of my pension away, and that I was making less than $1,000 a month, and I was single. But fortunately, the other day I received a check that shocked me, and I was scared to even cash it. I went to my bank and they said it's real. And then a couple of weeks later, I got a letter from Social Security saying that I was going to get X amount of dollars back because they were not supposed to have taken it out from my pension. And it was a boost for me. I mean, I feel like I don't make very much. If I did, I wouldn't be as spendthrift as I am. And I live with two sisters who are also on Social Security and pension. And we managed to live a pretty decent life, a thrifty life. But we were raised that way, not to waste our money. But we were also raised to work hard. And I just want to thank you and all your constituents for everything you've done for us and saving our Social Security for the future and our Medicare, and allowing us to be able to just get along. But not everybody is as fortunate as I was, with my two sisters saying, we don't want you to live alone and not be able to live comfortably, or at least, physically and whatever else, pay my bills and all that. So we live together and we help each other. And again, thank you so very much, and keep fighting for us. We will always support you.
I surely will, and you made me so happy by saying that, because it made such a difference. And the congressman that was on earlier with us, John Larson, fought for that as the lead member of his party, my party, on that particular committee. And President Joe Biden did that. He was signed the bill, and we were able to move a bill that is so important to workers in Ohio, to you, to others. Tens of thousands of people, by the way, had worked, and they were being docked on their Social Security for different reasons. And it was one of those bills that passed, and we just cheered. You just cheer, because that there are citizens like yourself who deserve better. And I hope you at least got yourself a double dip ice cream cone or something like that this past weekend, and bought some pretty flowers. But you're wonderful to share that story. And I just want to say for the third time on this program that for people who are 60 years or older, you qualify in our counties that I represent, 8 of them, all the way to the Indiana border, for the Senior Farmers Market Nutrition Program, which if you earn under $29,000 as a single person, or in a family of 2 under $40,000 a year, you can get this $50 coupon to go to our local farmers markets this summer and buy fruits, vegetables, honey, and herbs. And I just tell you that that's a really good deal, and you call the Area Office on Aging at 419-382-0624 to register. Last year we had over 22,000 seniors across our district apply, and believe me, it made such a difference to them.
Up next, we have Michael Green in Fremont. Michael, you are live on the call.
Yeah, that's you.
Hello.
Hello, Michael.
Hello, Marcy. How are you doing?
Pretty good. How's it down in Fremont today?
Not too bad. First off, Marcy, I'd like to thank you for all your hard years of work and service. It hasn't gone unnoticed. I was proud to say more than one occasion when I worked for the union in the Toledo area that I helped campaign for you and other constituents.
Thank you. Thank you very much.
And certainly would do it again. You're well worth it. But my question is, if this is money that we put in, to me, it's like putting money into a savings account. That money is ours for down the road,
yes,
whenever we're eligible. And if somebody takes that money out of there, is that not theft? And why aren't they being arrested and thrown in jail?
I'm going to let Max.
Well, yes.
You're thinking the right way. Michael, and I'm going to have Max tackle that one.
Well, that's been the overriding question at many of these town hall meetings. It's important that people listen to what the caller said. This is an earned benefit. It is invested in government bonds. One of the big lies out there is the money was stolen. There's no money there in the trust fund, just a bunch of worthless IOUs. That's a lie. The money that is paid into Social Security beyond what is needed to pay benefits every year is invested in government bonds, earns interest. Those bonds are rolled over regularly. The best way, Congresswoman, I've found to explain this is in the beginning of COVID, when we had enormous unemployment and less money was paid into Social Security because of that unemployment than was needed to pay full benefits. What happened? Everybody got their Social Security benefits because the trust fund was there. Those bonds made up for that shortfall. In fact, the size of the trust fund actually grew during that time because the interest was paid on those bonds. So it's real money. It belongs to people that have worked hard and paid into Social Security. And by the way, all the money that is needed to run the Social Security program, to pay for all those staff, the offices, the computers, that comes out of the payroll tax. So when someone talks about cutting the number of people serving Social Security beneficiaries, closing offices, cutting the money that's needed to operate the computers and the offices themselves, that's cutting benefits because that money is paid for and collected out of the payroll tax. So it's very important that those concepts are restated. And I wanted to just, if I can, go back to the previous caller who talked about the Social Security Fairness Act. Your constituents ought to know that you helped make that happen. And I know that because when President Biden signed that law that helped so many individuals around the country, there were a number of people invited to the White House and groups that had worked on it. As you know, we worked on it for a long time, and you were there in the White House, invited by the president, and we talked at that time because you were one of the principals that made that bill become a law and provided those benefits.
Thank you so much. That was historic, and all I could think of was the people back in Ohio in our region that would benefit, because in all my years in office, you can't imagine how many people have come up to me and talked to me about that issue. That was a great, great victory for our nation, for the people, the working people of our nation.
Yes, it was.
Thank you so much, and thank you for your staunch support of that, Max, to help move that through the Congress. And boy, I hope Congressman Larson is having good luck tonight. I sure hope so. Okay, we can go to the next caller, Jordan. Gordon.
Unfortunately, that is all the time we had for questions this evening. If you didn't have a chance to ask the Congresswoman your question, you can leave a voicemail for her and her staff simply by remaining on the line. With that, Congressman Kaptur, I'll turn it back over to you for some closing remarks.
Thank you very, very much, and thank all of those who've joined us this evening. I hope you enjoyed hearing questions from other callers, and just know I'm doing everything I can in the Congress, including working with people across the aisle where possible in a bipartisan way on reforms that will improve the lives for all the people that I represent and for our country. I'll never go along with any cuts to Medicare, to Medicaid, to Social Security, or any earned benefits that the working people that I represent have spent their lives doing. So I am just grateful for everyone this evening for joining us. And again, you can always call our office at 419-259-7500. And if you're interested in those local senior farmers market coupon programs, don't forget the area office on aging at 419-382-0624. Max Richtman, I am so grateful for your participation this evening. Is there any question we should have covered that we did not?
Well, there are hundreds of questions, and I hope you'll have me back to participate in a teletown hall, or better yet, invite me back to your district, which I always enjoy.
All right. Well, thank you so very much. Thank you for the phenomenal work that you do as the Chief Executive Officer and President of the National Committee to Preserve Social Security and Medicare. And may God bless John Larson tonight as he goes into battle inside the Congress in the Ways and Means Committee.
I agree.
Pray for him.
I agree.
Thank you. Thank you all for joining us this evening. Have a great, great week. Bye-bye.
Thank you.